This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
So next we'd welcome another Pennsylvania program. So we'll welcome Penn State. Feel free to take over the screen when you're ready.
All right, thank you very much for the introduction. Hello, my name is Morgan Engler. I am the current administrative chief resident here at Penn State Hershey Rehab. We also have a couple other people from our department here with us today. So I have my co-chief, Chad Mears, who you'll see, who's the academic chief. We have Dr. Romanowski, who's our program director, Michelle Osterlin, who's our wonderful coordinator, and our brand new chair, Dr. Amaswamy, you'll see as well. So we have great representation here tonight. So let me bring up the screen to share with you. All right. Can everybody see that?
Yes, we can.
Thank you very much. All right. So again, as I said, we are Penn State. We are the Physical Medicine and Rehabilitation Residency Program here at Penn State Hershey. We have been a fairly new program. I'd say we've dipped our toes into the water for 5 residency classes now. So we're starting to really get pretty well established into the swing of things here. But we are excited to be able to share our program here with you tonight. So I'm going to start with some advantages of living in Hershey, Pennsylvania, and I'm going to thank the gentleman from Geisinger and Danville for helping us advertise our wonderful state. In Pennsylvania, we have a relatively low cost of living, especially if you're living outside of the Philadelphia and Pittsburgh areas. So in Hershey, again, we have several residents who are able to afford houses here. Cost of living is relatively low. We have essentially no traffic in terms of commute. So we have residents who live, all over in, Lebanon or Harrisburg or some other interesting parts around the state who don't have issues getting into the rehab hospital within 20 minutes or so. So that's a wonderful perk. We have some really excellent school districts here, including the Milton S. Hershey School, which is a very renowned, well-established school for children in need from the greater Pennsylvania area. It's actually a live-in school that's a wonderful, wonderful program. We have Hershey Park, which is one of my favorite amusement parks in the world. Great Bear is a wonderful coaster, and it's always adding and improving. So it's always something to bring your families to, and that I know a lot of co-residents with kids have season passes and go again and again and just keep enjoying it. Attached to Hershey Park is Chocolate World. It's a free attraction that is also very fun. Outside of Hershey, we have the Harrisburg and Lancaster areas, which are also very fun to explore. Harrisburg has some really good downtown amusements and festivals. They have a wonderful walking track along the river, including City Island, which always has events. And Lancaster is very up and coming, surprisingly. I'll admit I haven't been there in a little while, but I recently was watching a YouTube video and it was named like one of the most up and coming places to live for young people in terms of quality of life, low crime, and low cost of living. So that's awesome. And in addition, like I said, Pennsylvania, this is a very active community. So we have lots of hiking, lots of access points to the Appalachian Trail, snow sports. We have some ski hills in the local area, as well as I know that cross country is very popular here as well. We have multiple breweries and wineries. The Trogs Brewery is right down the road from the rehab hospital, which I enjoy very, very much. It's just this great, vibrant community that's always building and has truly been a wonderful place to live the last couple of years. In terms of leadership, I already introduced a couple of these guys, but just to mention them again, Dr. Romanowski is our program director. She has been for the last couple of years, and she's done an excellent job. Dr. Anaswamy, who we are excited to bring into the department, has a very strong research background, and we are excited to see where he takes the program. Michelle Osterland is our program coordinator. She is a superstar. I remember when I was interviewing at programs as a student, she was by far the most organized and helpful coordinator that I interviewed with, and she continues to be so throughout residency training. So truly a stellar addition to the team. And then Chad, the academic chief, and myself, the administrative chief residents for this current year. We have 3 training locations. Penn State Milton Hershey Medical Center is a massive hospital. It's 548 beds along with 72 dedicated pediatric beds. They have a brand new cancer center and women's and children's pediatric institute with lots of very wonderful staff and new technologies that are fun to interact with. We do consult services over there as well as pediatric rotations, and there are multiple outpatient clinics associated with the hospital and little satellite clinics as well that we do plenty of rotations on at the campus. Most of our inpatient rotations are at the Penn State Health Rehab Hospital itself. It is a freestanding rehab hospital about a mile down the road from the main hospital. We are currently sitting at 66 adult beds and 10 pediatric beds in the hospital, but we are adding 13 additional beds from the old upstairs unit to the inpatient rehab hospital. No word yet on when that's going to be finished, but we are excited to be expanding and have those resources available to us. We also have rotations at the Lebanon VA Medical Center. There we do outpatient clinics, especially prosthetics and orthotics are very strong over there, as well as outpatient EMGs. And our program is a wonderful group of pretty strong individuals. We have a lot of fun here. We enjoy each other's company. A couple pieces of note here. You can see up in the upper left-hand corner, that's just the snap corner of our residency room. The main inpatient rehab hospital has a dedicated room just for the residents where you'll each have your own place to work, as well as a fridge and table and everything available to you. And a back room with an OMT table if you so choose to utilize it. Down below that, you can see our anatomy and MSK didactics. Dr. Charon, who you can see down there in the dark blue scrubs, has been working very hard to develop a very strong MSK curriculum with us. So we've been very excited to be implementing that. In the middle here, we have our 2 most recent graduates, Molly and Zach, who are both down at the University of Miami now pursuing individual fellowships. They were great to work with, and Zach was a true personality who we are missing. And at the very right-hand side of the screen, you can see our most recent full house residency picture. So every year we accept 4 students for advanced residency positions. Prelim year is separate, although we do have several residents who choose to do it at Hershey Medical Center through the internal medicine program here. And I know that Chad was a part of that, so he can speak more to it if you're interested. And we have had successful reaccreditation yearly. Like I said, we've been going strong for 5 classes now, and we are running at this point. So here's an example of the typical rotation schedule for a PGY2, a new resident in the program. Our PGY2 year, as with most programs, tends to be pretty inpatient heavy and pretty core subject matter to inpatient rehab. So divided up into 1 to 2 month blocks, we have spinal cord injury, traumatic brain injury, complex care, and SCI services, and CVA services. In addition to that, as part of resident feedback, which is another follow through of this, as part of being a program that's been in development, the last 5 years or so, they've been very open to resident feedback and to altering things based on resident feedback. And so part of that has been the addition of a clinic block in your first year, just to break up the inpatient rotations and get you a little bit of experience with how clinic runs and how to do the procedures before you hit the ground running on your PGY3 year with those primary outpatient services. For PGY3, we have a 3-month dedicated block of EMGs that we perform with the neurophysiology department. It's a very fast-moving clinic. We learn a lot with the neurologist there, and I think it's a pretty strong rotation. We have the consult service with Dr. Charon at the main hospital, sports and pain medicine rotations, as well as a very strong pediatric block for 3 months. We just hired on a third dedicated pediatric physiatrist, but Dr. Sachnibar and Dr. Wright, who currently run the service, have a ton of pediatric volumes, some very interesting cases, and run very interesting both inpatient consult and outpatient services for the pediatric group. In between, we also have several months of clinic, which includes specialty clinics such as spinal cord injury and traumatic brain injury, as well as procedures. And then we also have 4 weeks of elective time available throughout residency that you can dedicate to whatever specialty you are interested in. As a PGY4, it is a continuation of getting more procedures, more clinic time, more hands-on experience as you develop into an independent practitioner, additional consult services, and we come back for 1 inpatient rotation currently in our PGY4 year. I myself am very happy with that. I'm interested in inpatient physiatry, and I'm looking forward to getting back to the inpatient services before heading out as an attending physician, just because at this point, it's been a couple of years since we've been through that. So I think that was a very good move by the department. Again, strong procedures blocks for multiple months with our physician, Dr. Shi, Dr. Charon, and Dr. Romanowski. Dr. Shi does do dedicated outpatient pain medicine at an outpatient surgery center about once a week, and the rest of the procedures are primarily in the office, either Botox, neurolysis, ultrasound guided injections, or EMG guided injections, which is a very fast moving but very fun clinic. In regards to research, we have 40 half days dedicated throughout residency, generally cut into clinic and procedural blocks. And it's longitudinal, which was, again, a change that was made based on resident feedback. So instead of having 1 dedicated month for research where you may or may not be able to have a project completed and then have to do the rest of it in your free time, we have these days spread out over the course of your residency so that you have time to catch up where you need to and can sort of spread your resources throughout and maximize your time. We also have annual resident research days to present our research and get feedback from faculty and fellow residents on how we're doing, how we can improve our projects. And we also have yearly QI projects, which are completed in teams. And we have dedicated time to work on these through our residency year, which includes some didactic time that's dedicated with, general check-ins and feedback on how to improve our QI sessions. Didactics themselves are on an 18-month cycle, so similarly, you come back to the same didactics at the end of your residency as the ones you started in to hopefully reinforce that information. We have protected didactics with breakfast served, which is awesome, every Monday morning for a 3-hour block. So coming off the weekend, you generally get a little bit of extra time to start that morning. The didactics start at 8:45. So you come in, get your breakfast, sit down, have a nice smooth transition off the weekend, get some learning in before you head back to your dedicated clinic or inpatient time. The blocks that we go through for didactics currently are intro along with a cadaver lab, which we start in the beginning of August every year, which has been an excellent addition. So we have 2 dedicated cadavers that we are currently working on with anatomists to help identify relevant structures for clinical anatomy. And Dr. Shi is also present at these sessions to help practice ultrasound guided injections, which has been awesome. We also have EMG blocks, SCI stroke, all the main services. We have, as I said, Dr. Charon has developed a dedicated longitudinal musculoskeletal ultrasound didactic course, which has been great and has again, as a follow through, been subject to resident feedback, constant improvement, and I think has become a really strong course, as well as prosthetics and orthotics, and then additionally geriatrics, rheumatology, and a couple check-ins for QI and research projects built in as well. Other extra educational sessions that we support monthly on Friday afternoons, typically we will do morbidity and mortality rounds. This is not punitive and typically not involved in any kind of mortality, but it is an opportunity to review patients that were sent out of the inpatient rehab hospital or really complex cases, and just make sure that we're all up to snuff on our internal medicine and clinical decision making, and be able to look across the department to see how to improve our own education and our thought processes moving forward. Journal clubs, which are now led by attending physicians and cover instrumental topics and really foundational research in the field of PM&R, along with some other fun topics, primarily, virtual reality applications and things like that. And grand rounds, which, is a grab bag, but are typically excellent didactics. Like I said, we have a resident research day every year, along with career panels, physical exam skills workshops. We recently did our wheelchair prescription workshop, which was awesome. We had the PT and the reps from the wheelchair clinic come in and with all the major options available and demo the pros and cons of each system to us, which was great. Exercise prescription workshops, board reviews for PGY4s, gait workshops, CAKES conferences, oral board preps for PGY4s, Botox and baclofen fin pump workshops. And recently the PGY4s also got to be involved in a multidisciplinary musculoskeletal ultrasound workshop with the radiology department, which added a whole new spin on things and was really useful. For call, we have a pretty excellent setup. So we take home call, which, as described in the last lecture, you have to be, I believe, within 20 minutes of the rehab hospital, but you get to sleep in your own bed and keep your pager on you and log in from home for the majority of calls. It's pretty rare that you have to go into the rehab hospital for emergencies, but it does happen occasionally. But definitely much better than intern year all around. PGY2 and PGY3s go on a rotating call schedule. They're on call generally once every 8 weekdays, Monday through Friday, and once every 8 weekends for Saturday and Sunday, from Saturday 8 a.m. to Monday at 8 a.m. On weekends, you generally run at the rehab hospital with an attending somewhere between 7 and 8 a.m. By noon, you're finished rounding and take admissions for, into the early afternoon, and then have an opportunity to go home, which is great. And a big bonus for us is that, first of all, as a PGY2, your call doesn't start until August. So you have a whole month to orient yourself to the rehab hospital and how systems work before you are put on the call schedule. And as a PGY4, you have no primary call. You are on the backup call schedule, but I can tell you it is so far been awesome to have the opportunity to take my weekends back with my family and enjoy the no call life for one final year before attending SHIP. So it's a real good quality of life, I think, perk of the program. Everybody is assigned only 1 to 2 holidays over the entirety of their residency here. Split over New Year's, MLK, Memorial Day, the 4th of July, Labor Day, Thanksgiving, and Christmas. The way the system works is we weight each holiday on number of people who are interested in participating in it. For example, Christmas has a pretty heavy weight, and Memorial Day has a pretty light weight, and we try to attribute those points and roughly equal it out by the end of your residency. So for example, if you take Christmas one year, you shouldn't have any other holidays that you're on call while you're in the program, which is great. When you are on call, you are first call, with the attending always available as backup, and they always encourage us to call if there are ever any questions. I've never had an issue with any pushback from an attending or with issues getting a hold of an attending when they were needed, and they've always been very helpful and very open for us. These are our graduating classes, and we are starting to get to the point where we may run out of space here. But as you can see, we've had people go all over the place and pursue all kinds of opportunities from our program. Some that I have had the pleasure of interacting with are Bill Reek and Samantha Willer from the class of 2021, both matched into sports fellowships. Renuka Rudra, who was a Payne Fellow here at Penn State this past year. And our last class, Zach and Molly, both matched at the University of Miami, Zach going into spinal cord injury and Molly going into a TBI fellowship. So we have, sports fellows, spine fellows, and Payne fellows, TBI fellows, people going into very competitive fields. And we've had a lot of success with being able to get people the research and support that they need to be able to pursue those fellowships. Our in-house institutional fellowships include brain injury and spinal cord injury, and the anesthesia department with Penn State does run a pain fellowship for which they do reserve spots for PM&R every year, and we've been very successful with matching our residents into those pain spots. Some benefits of the program. We do have extra funding for people presenting at conferences every year. We currently sponsor 4 residents per year for this, but it's something that's in flux and we're always looking at improving. $750 per year in CME money to dedicate to essentially whatever you want. A popular option is tablets, but also any kind of books, society memberships, extra funding for conferences, whatever you can justify through educational needs. We get $175 a quarter for food and coffee allowance, and that does work at the Starbucks in the hospital. We get memberships to AAPM&R and AAP. We get a stack of textbooks, including Bradham's and the Essential EMG guides that are awesome to have on hand. We have 4 weeks of elective time throughout our residency. As PGY4s, we can moonlight, and I have 3 co-residents who are currently doing so and have been able to generate some extra income from that, which has been major. And we have a paid board review course at the end of PGY4 year to help us prepare for boards. So what is resident life and community involvement like at Penn State Hershey? Honestly, we talked a little bit about it in the beginning, but it's great. We really enjoy each other. The co-residents have been awesome. We get out when we can, and there are some awesome food options in the Harrisburg area and other community options around the Harrisburg area. We've been talking recently about reinstituting resident field days, which would be great. That was put on hold with the COVID era, but things are starting to open back up again, which is a very exciting time for us. So we are, a pretty active group in general. People in Pennsylvania tend to be, and we really tend to enjoy each other's time.
Okay.
One extra benefit of our program is, I know Dr. Rudra's class had put forward an initiative to improve resident diversity and combat cultural discrimination and racism in our program. All of the major tenants in our program signed on to this initiative and I think have stood by it. And I am fairly excited to say that the residency class coming up, not this year, but the current PGY ones that will be PGY2s next year, is an all-female class, which is awesome. If you have any questions or want to reach out to anyone, we are all free and happy to chat. Again, that's my contact at the top, mengler@pennstatehealth.psu.edu. We will put these links back in the chat as well. You can also reach out to Chad, our wonderful program coordinator, Michelle, and our wonderful program director, Dr. Romanowski, if you have any other questions. And we hope that you consider the sweetest place on earth. We have a great time here in Hershey and we would love to have you. So I will end there and open up the room to any questions.
Yeah, sorry, Dr. Engler, time is up. So I'll feel free to hang around and answer questions in the chat box. We'll move on to some of our Midwest programs for tonight. By Michigan State.
Fair enough. I'll throw out my email in the chat if you guys have any questions. Thank you for your time.